Hello everyone, my name is Dua,
My name is Miriam.
and our presentation is on toddler topics. The three topics we'll be covering are discipline, temper tantrums, and toilet training. Our first topic is on discipline. So discipline means to teach or refers to a set of rules governing conduct. In other words, it refers to the action taken to enforce the rules after noncompliance. The purpose of discipline, as mentioned, is to teach and it's not to punish. The way we teach is through limit setting. Limit setting refers to establishing the rules or guidelines for behavior. For example, parents can place limits on the amount of time children spend watching television or chatting online. The clearer the limits that are set and the more consistently they are enforced, the less need there is for disciplinary action. Children need limits. Unrestricted freedom is a threat to their security and safety. Minimizing behavior. The reasons for misbehavior may include attention, power, defiance, and a display of inadequacy. Children may also misbehave because the rules are not clear or consistently applied. Acting out behavior, such as temper tantrum, may represent uncontrolled frustration, anger, depression, or pain. Some interventions that can be implemented include setting realistic goals, keeping any promises made to children, structuring the environment to prevent unnecessary difficulties, offer sympathetic explanations for not granting a request. So for example, instead of saying no, the parent can explain to the child why no is being said, and then teaching desirable behavior through own example, such as using a quiet, calm voice rather than screaming. So guidelines for implementing discipline. So regardless of the type of discipline used, the following principles are essential to ensure the efficacy of the approach. So consistency. So implementing disciplinary action exactly as agreed on and for each infraction. So if a child misbehaves and during that behavior, a discipline is implemented, and then another time where the child does the same action or misbehaves again, and then no discipline is being implemented, then no change will occur because there is a consistency. So timing, so initiate discipline as soon as a child misbehaves. Commitment, follow through with the details of the discipline, such as timing of minutes. Unity, make certain that all caregivers agree on the plan and are familiar with the details to prevent confusion and alliances between the child and one parent. So if one parent is implementing discipline and the other parent is not following through, then the discipline the one parent is implementing will not be effective because there's no consistency and the parents are not on the same page when it comes to disciplining the child. And then flexibility, so choosing disciplinary strategies that are appropriate to the child's age and temperament and to the severity of the misbehavior. So when choosing a type of discipline, it's important to consider a child's personality, temperament, their behavior. It's important to also keep in mind that each child is different. So if there's multiple children in the household, each child, of course, has their own personality. So when a parent is choosing a discipline, it's important to consider certain factors because one type of discipline might not work for every single child. Planning, so plan disciplinary strategies in advance and prepare the child if feasible. So explain the use of timeout and try to discipline when you're calm. Behavior orientation, always disapprove of the behavior, not the child, with such statements as, that was the wrong thing to do. I am unhappy when I see behavior like that. Privacy, administer discipline in private so that the child does not feel ashamed in front of others. So when a parent is disciplining a child, it's important to do it in private and not in front of others because the purpose, again, of discipline is to teach and not to punish. And so if you're doing it in front of others, then the child might feel ashamed or embarrassed, and they might feel some feelings of resentment towards their parent. And then termination. So after the discipline is administered, consider the child as having a clean slate and avoid bringing up the incident or lecturing. So once that discipline is implemented, it's important that the child does not bring it up again and to move forward. So there are certain types of discipline. So there's reasoning, involves explaining why an act is wrong, and this type of discipline is usually appropriate for older children, just because young children cannot be expected to see the other side because of their egocentrism. And then toddlers in the preoperative stage have a limited ability to distinguish between their point of view and that of others. Then there's scolding. Scolding takes the form of shame or criticism. For example, "You are a bad boy for hitting your brother." So when saying that statement, the parent is implementing that the child is a bad person instead of focusing more on the action. So this type of discipline is ineffective. Then there's positive and negative reinforcement or behavior modification theory. So a behavior that is rewarded will be repeated, and a behavior that is not rewarded will be extinguished. So when a child does a positive behavior and that child is rewarded, then there's a high chance of that behavior to be repeated again in the future. So using rewards is a positive approach. It encourages children to not misbehave, and there's different types of ways to reward a children. A chart can be done where each time a good behavior is done, they can receive a token, and then at the end they can receive like a big prize. And then there's ignoring. So consistently ignoring behavior will eventually extinguish or minimize the act. However, this type of discipline can be hard, and for it to work, it has to be implemented consistently, and sometimes it can be difficult for parents to consistently ignore a behavior. Then there's timeout. So timeout involves sending the child to his or her room. It is based on the premise of removing the reinforcer. So timeout offers both the child and the parent a cooling off time. And when a parent is putting a child in timeout, it's important to select an area that is safe, to determine what behaviors warrant a timeout, to ensure the child understands the rules, and explain to the child the process of timeout. Also, it's important to explain to the child why they're being put in timeout. A rule for length of timeout is 1 minute per year of age. Then there's physical punishment, and this takes the form of spanking. So although there is some research that discusses the benefits of spanking, there's actually more harm than benefits with this type of discipline. So physical punishment teaches the children that violence is acceptable. So they think that it's the norm or that it's normal, and they can grow up accepting this type of behavior. It can cause physical harm and interfere with the child's development of moral reasoning. And the children can become accustomed to spanking. And if they become immune to spanking, then they might require more or severe punishment. And this is a short video that talks about 6 positive discipline techniques for children.
Remember to subscribe and don't forget to hit the bell icon to never miss an subscribe.
So in this video, it just talks about a lot of the things that I mentioned earlier. So number 1 being no bad kids, only bad behavior. So when you're explaining to the child why behavior is bad, we're focusing on the behavior and not telling the child that you're a bad child or I'm disappointed in you. Instead, we'd say that we're disappointed in your behavior. So if your child hits someone, you can politely say you should not hit others and apologize for your actions, rather than calling him naughty or bad boy. This way, your child will learn he needs to change his behavior. And then 2, show him how to behave. So if you notice that your child is about to do something wrong, rather than simply saying, don't do that, instead tell him what he should do. Teach your kid how to behave properly by showing him the right way to behave. And then number 3, as mentioned, introduce timeouts. Timeout is not a punishment. They're more like a cooling off period for the child where he can introspect his behavior. The best way to do this is to set up a chair at a secluded place where your child can sit for a while, not more than 5 minutes, and think about his behavior. Number 4, offer choices. If your child has hit someone, you can offer 2 choices. For example, do you want to apologize for hitting, or would you like to go into timeout? This will give your child a feeling of control. And then 5, reward good, as we mentioned earlier. So we want to reward good behavior. So good behavior should always be rewarded, as it can encourage your child to keep behaving in that manner. Rewarding your child should not be confused with bribing your child. If you try to motivate your child by offering a reward, if he behaves well, this is a bribe. And then lastly, setting boundaries and expectations. It's great if your child loves to play, but still you need to set firm rules about playtime. For example, your child can play after finishing his homework. So these are some 6 positive strategies that parents can implement. Moving to temper tantrums. So toddlers may assert their independence by violently objecting to discipline. They may lie down on the floor, kick their feet, and scream as loud as possible. Tantrums are an indication of the child's inability to control emotions. Tantrums can also be an indication that a child has difficulty expressing themselves, and children with certain developmental delays can have this difficulty. So it's important for our parents to recognize difficulties that children have when expressing themselves and to teach them effective techniques that allow them to express themselves appropriately. Temper tantrums commonly occur when the child is ill, hungry, frustrated, or tired. Some use tantrums to get parental attention, get something they want, or avoid having to do something. So when temper tantrums occur for whatever reason, let's say that child is having a tantrum because he wants to get something. If that parent is consistently giving in, it teaches a child that having a temper tantrum is a way to get what they want. So it's really important for a parent to not give in to temper tantrums, because then they're reinforcing that behavior. So tantrums are common during the toddler years and represent normal behavior. They represent normal developmental behaviors. However, tantrums that occur past 5 years of age, last longer than 15 minutes, or that occur more than 5 minutes a day are considered abnormal and indicate a serious problem. The best approach toward tapering temper tantrums requires consistency and developmentally appropriate expectations and rewards. During tantrums, ignore the behavior if it is not injurious to the child and continue to be present to provide a feeling of control and security once the tantrum has subsided. Offer the child options instead of an all or none position. Pick one's battles carefully and ignore small skirmishes over unimportant issues. Give comfort once the child is able to control emotions, but do not give in to the original request, and praise the child for positive behavior when he or she is not having a tantrum.
So moving on to toilet training. One of the major tasks of toddlerhood is toilet training. Between the ages of 18 to 24 months, voluntary control of the anal and urethral sphincters are achieved sometime after the child starts walking. However, in order to be ready for toilet training, the child must have psychophysiologic factors. So these are required for readiness, such as recognizing the urge to have to use the bathroom, as well as holding on and being able to communicate the sensation to the parent. So the child should know when they're able to use the bathroom and be able to hold it in, as well as let their parent know that they need to go. And readiness is not complete until ages 24 to 30 months. However, parents should begin preparing their child earlier than 30 months. And this is because by that time, the child has mastered the majority of essential gross motor skills. They can communicate intelligibly, and they are in less conflict with their parents in terms of self-assertion and negativism, and they are aware of the ability to control the body and please the parent. And so 3 markers can signal the child's readiness to toilet train, and this can include being aware of the urge to void or stool, interest in and or motivation to use the toilet. And so the child will be excited to have to go use the bathroom, as well as being dry for at least 2 hours during the day. So as a nurse, it's important to teach the parent how to know when their child is ready to be toilet trained. And so when assessing their readiness, different factors can be looked at, such as physical readiness, which can include voluntary control of the anal and urethral sphincters, the ability to stay dry for 2 hours, decreased number of wet diapers, and waking dry from a nap, having regular bowel movements, gross motor skills of sitting, walking, and squatting, and fine motor skills to remove clothing. When it comes to mental readiness, the child will be able to recognize the urge to defecate or urinate. So they'll be able to know when they have to go to the bathroom. They'll have verbal or non-verbal communication skills to indicate when wet or when they have the urge to defecate or urinate. So they'll be able to show the parent in some way that they either have to use the bathroom or that they need to be changed, or that they're ready to go, as well as having cognitive skills to imitate appropriate behavior and follow directions. So psychological readiness will include expressing the willingness to please the parent. So once the parent shows the child that they are happy that they're being able to use the bathroom, the child will want to please the parent more and show them that they are able to carry out that task. Having the ability to sit on the toilet for 5 to 8 minutes without fussing or getting off. So this can show that the child is interested in using the bathroom instead of wanting to get off right away. Or being impatient with their soiled or wet diapers, and having the desire to be changed immediately. So the child will obviously want to be changed once their diaper is soiled. And then parental readiness. So the parent will know, they'll be able to recognize the child's level of readiness. They'll have the willingness to invest the time required for toilet training, and there will be absence of family stress or change, such as divorce or job loss, which can also impact whether the child is being toilet trained or not, because the parent might not have the time to focus on the child directly to teach them how to use the toilet, and focus on other things and other stressors going on in their lives. And so, as I just mentioned, here are some signs that the child will be ready to be toilet trained, such as knowing that they have a wet or soiled diaper. They'll tell you when they are wetting or soiling their diaper. They're going at least an hour between wet diapers. They'll show that they need to use the toilet. They'll be fidgeting somewhere or hiding away, and they'll tell you when they need the toilet. And so here are some toilet training techniques that parents can use when going through this process with their child. So they should begin the readiness phase of toilet training by teaching the child about how the body functions in relation to voiding and having a stool. And they can also talk about how adults and animals perform such functions and compare the two. And important considerations are the selection of the child's clothing and the potty chair or use of the toilet. So different things can make it easier for the child to go to the toilet. So a freestanding toilet chair can allow the child to feel a sense of security. And then a portable seat attached to the toilet may ease the transition from potty chair to a regular toilet. Practice sessions should be limited to 5 to 8 minutes. You don't want the child to be on the toilet for too long and get tired or bored of using it. This could lead to them being uninterested in wanting to learn. The parent should stay with the child and practice sanitary habits after every session. So the child should obviously know that they should wash their hands after using the toilet. Dress the child in easily removed clothing, using training pants, pull-on diapers, or underwear, and encourage imitation by watching others. So if the child is dressed in something that's hard to get out of, that might cause them to use the bathroom in their pants or to soil themselves, and they won't be able to get out of it fast enough. So it's important to put them in something that's easily makes them easily able to get out of it, so that they'll have enough time to go to the toilet, such as those training pants or the pull-on diapers. And then when encouraging them to imitate by watching others. So as they watch others perform a certain task, they're going to want to copy them and learn how to do the same thing. And then they should be praised for cooperative behavior and successful evacuation. So by telling the child good job, giving them rewards such as like stickers each time they go to the bathroom successfully, or telling them that they're going to get a reward if they make it to the toilet in time. And here are our references.